Hope Clinic was started by 4 Asian women around the kitchen table. They managed to create a volunteer clinic that operated 4 days a month out of the Chinese Community Center. 2005, Katrina happened and brought 15,000 Vietnamese evacuees from Louisiana to Houston. The city was very ill prepared to work with a Vietnamese community, and they called onto this group of Asians that were doing volunteer care and said, come help us treat and help the Vietnamese community that came from Louisiana. They highlighted the fact that Asians are not necessarily the model minority, but they actually have really significant healthcare needs and disparities. We provide all kinds of pediatric care, women's health, adult chronic care management, pharmacy, dental, vision, behavioral health. But we also have a very strong component of community outreach. And we go and work with our partners. Remember, the community here in Houston is very diverse, so we really rely on our partners to be able to take the message out. Our role is limited to making sure that we are providing accurate information, timely information, and we're helping them get organized to get their voice out into the community.
So if organizations can onboard directly from the communities they serve, if once they identify those leaders, they can bring them on board, we find that that has been the most effective strategy at reducing vaccine hesitancy. And that's because they can facilitate conversations around trauma. Many communities that we serve have faced trauma directly themselves or have faced generational trauma. The clinic as a whole provides services in over 60 languages, and our staff speak 30 languages. So where language access might be a huge gap in other areas of Houston, in our service area, we try to overcome that by making sure that our staff is equipped with those language access services.
I think that over the years, we have really been able to put together a really nice coalition of community organizations, and that we work collaboratively to address different emergent issues. So we've worked collaboratively to address census, helping people enroll in the Affordable Care Act, hepatitis B and tuberculosis, really things that may not be so important for the rest of the community, but for these multicultural communities is critical. During COVID, we were definitely out in the trenches reaching out to those with limited English proficiency. And now we are trying to engage people in immunizations, right? Because we're so far behind in our immunization rate. So really trying to work with communities to bring back the trust and catch them up with all their vaccination needs. I think that the support that we've gotten from the Health Forum to be able to do that work has been critical, because the funds really went a lot into helping other community organizations as well, to reach out to their communities and for us to bring the message where and how to get the vaccines and actively support them when they are doing their outreach efforts in their communities. The clinic has been, in the last few years, devoting much more resources to interventions and activities that will result in structural changes to the way people and the place people eat and live and play.